Hello and welcome to the Project iCare podcast. This is a recording for healthcare providers who want to learn more about improving care for patients with substance use issues and addictions. I'm your host, Dr. Kasey Claborn, a clinical psychologist and research scientist at the University of Texas Dell Medical School.
And my name is Sydney. I will help narrate this podcast by defining terms, explaining concepts, and citing statistics that are relevant to the topic.
Have you ever had a patient who struggled with alcohol use and you didn't really know what to do? That's what we will be talking about on this week's episode, where you'll learn about the effects of alcohol on a person's health, how to determine if someone is drinking too much, and what different treatment options are for people with an alcohol use disorder. Today we are podcasting from Providence, Rhode Island with Dr. Jennifer Merrill. Dr. Merrill is an assistant professor in the Department of Behavioral and Social Sciences at Brown University. Welcome, Dr. Merrill.
Thank you.
Today we are talking about alcohol use and misuse. So I'd like to start off with you telling us a little bit about how alcohol affects a person.
Okay, so some of alcohol's main impacts are due to how it affects the central nervous system. A lot of people incorrectly think that alcohol is a pick-me-up or a stimulant because initially when people have a drink, it may cause them to become more animated or less reserved. But the opposite actually occurs as they continue to drink and as more alcohol enters the brain. So technically alcohol is a depressant of the central nervous system, meaning it slows activity down. And the degree to which that brain activity slows down depends on how much a person's drinking and how fast they're drinking. Basically, the higher the blood alcohol concentration is, the more impaired someone becomes.
Blood alcohol concentration, or BAC, refers to the amount of alcohol in a person's bloodstream. BAC is a metric of alcohol intoxication and is expressed as a percentage of ethanol in the blood. In the United States, the legal blood alcohol concentration for drivers over 21 when driving a vehicle is 0.08%. While BAC varies based on alcohol consumption rate and weight, an average American male weighing 190 pounds will reach the legal limit after just 4 drinks.
Some of the central nervous system depressant effects that people experience include altered or slurred speech, hazy thinking, impaired judgment, having a slowed reaction time, dulled senses, so for example, impaired vision or impaired hearing, and difficulty balancing. So alcohol can reduce communication between your brain and your body, which makes coordination more difficult. A couple of additional short-term impacts of alcohol intoxication can include sleep disturbances. This is another kind of misconception. While small amounts of alcohol may initially have a sedating effect and help someone fall asleep, overall it really disrupts sleep and doesn't allow somebody to get a good night's sleep. And finally, memory impairment. So alcohol-induced amnesia or blackouts are especially likely to occur when someone drinks quickly and drinks a large amount of alcohol. During a blackout, someone is still conscious, they're awake, so it's different from passing out. Someone can have a conversation, they can move, but they may not recall either some or all of the events that happened while intoxicated, which can be really dangerous.
So what are the signs of a person drinking too much?
So we might think about drinking too much on a given occasion. And in that case, any of the signs of intoxication that I mentioned above might signal having consumed too much. So again, things like slurred speech or difficulty balancing. We also might think about whether someone is exceeding low-risk drinking guidelines. And these guidelines put forth by the National Institute on Alcohol Abuse and Alcoholism, or NIAAA, suggests that men should consume no more than 4 standard drinks in a given day and no more than 14 standard drinks in a week. Women should consume no more than 3 drinks in a day and no more than 7 drinks in a week. And one thing that's important here is that although these are low-risk guidelines, they don't mean no risk at all. So even with these limits, alcohol can cause problems if people are drinking too quickly, if they have health problems, or if they're older. So based on someone's health and how alcohol affects them individually, they may need to drink even less than these guidelines or not at all.
That's really interesting. So Dr. Merrill, you mentioned standard drinks. How is a standard drink defined, and how do I know what a standard drink is?
That's a great question and something that I think that not a lot of people are aware of. So these guidelines that I mentioned, guidelines rely on standard drink sizes. And in the U.S., a standard drink is any drink that contains about 0.6 fluid ounces or 14 grams of pure alcohol. So basically 1 can or bottle of beer counts as 1 standard drink, assuming it's only 5% alcohol. But now that a lot of craft beers are emerging, these tend to have higher levels of alcohol and therefore would count as more than one standard drink.
That's really good information. So what about like wine or liquor? How do you tell if that's a standard drink?
So for wine, 5 ounces counts as one standard drink. So in a bottle of wine, there are about 5 standard drinks. And then for liquor, 1 shot or 1.5 ounces would count as one standard drink, assuming it's only 80 proof or 40% alcohol. So again, if you have some kind of martini that has 2 shots of alcohol in it or 2 shots of liquor, that would count as 2 standard drinks, even if it's in a single glass.
Wow, that's really helpful. What are some signs that a person is developing a problem with alcohol?
It can be pretty easy to tell when a person has been drinking at all, but identifying some kind of problem with alcohol can be more difficult. People with the problem might be able to hide some of the more obvious symptoms of an alcohol use disorder for a long period of time. And initially, a few mild symptoms might appear but might not be seen as problematic, but they can really signal the start of a drinking problem. And then if heavy drinking continues, over time the number and severity of symptoms can grow and can add up to an alcohol use disorder.
In 2015, the NIH's National Institute on Alcohol Abuse and Alcoholism found that 15.1 million adults, or 6.2% of all adults, had an alcohol use disorder. And of these 15.1 million adults who had an alcohol use disorder in the past year, less than 7% received treatment.
So how exactly is an alcohol use disorder defined, or how exactly is it diagnosed, and who can diagnose?
Doctors will diagnose an alcohol use disorder when a patient's drinking is causing some kind of distress or harm to the person or to others. So any medical doctor or health professional can diagnose an alcohol use disorder. In terms of how this is diagnosed, there's 3 levels of alcohol use disorder: mild, moderate, and severe. And the level depends on how many of 11 possible symptoms are endorsed. So 1 is that alcohol is often taken in larger amounts or over a longer period than was intended. So somebody is drinking more than they meant to on a given occasion, or they're drinking for hours when they had planned to only drink for a short period of time, and this is happening repeatedly. A second symptom is that there's a persistent desire to cut down or control the alcohol use, or the person has tried unsuccessfully to cut down or quit their drinking. Third, a great deal of time might be spent on activities necessary to get alcohol, to use alcohol, or to recover from its effects, so having hangovers the next day. A fourth symptom is craving. In other words, some kind of strong desire or urge to use alcohol might be present. Fifth, recurrent alcohol use might result in a failure to fulfill major role obligations. So if somebody's not showing up for their shifts at work, or they're missing classes at school, or they're not taking care of their children at home. Another one is if important social, occupational, or recreational activities are given up or reduced because of alcohol use. So the person may be spending more of their time drinking than doing the things that they used to enjoy. Additionally, recurrent alcohol use in situations in which it's physically hazardous. So, for example, driving while intoxicated or operating machinery if your job requires something like that. Alcohol use might be continued despite knowing that it's causing some kind of physical or psychological problem. The 10th symptom is tolerance, and tolerance is defined by either needing more to become intoxicated or to feel the way you want to feel from alcohol, or even if you're drinking the same amount, you're just not getting those same effects that you used to get. And finally, withdrawal, which is either having symptoms such as trouble sleeping, shakiness, restlessness, nausea, sweating, racing heart, or seizure, even hallucinations when somebody does not have the alcohol, or if the person is purposely drinking to alleviate these symptoms and avoid them. And these withdrawal symptoms are particularly concerning. So alcohol withdrawal can be really difficult and even life-threatening. So people might seek medical detoxification to get sober, which is really the safest way to ensure that you break the physical addiction. So as I mentioned, the levels range from mild to severe, and so even if somebody has just 2 of these 11 symptoms, they would meet the criteria for a mild alcohol use disorder.
So then talk to me about more of the severe alcohol use disorders. What causes some people to become addicted to alcohol while other people may use the same amount and not ever become addicted?
Yes, it's a really difficult question to give you one single straightforward answer to, but basically there are countless theories about why some people develop alcohol use disorders while others don't. But in general, theories suggest that for certain people, drinking has different and stronger impacts that can lead to alcohol use disorders, and there are lots of different risk factors. Further, over time, if somebody's drinking too much, alcohol can change the normal functioning of certain areas of the brain associated with things like the extent to which you experience pleasure. So this can result in craving alcohol in order to try to restore good feelings or to reduce negative feelings.
Can you talk more about some of those risk factors?
Sure. So one would be kind of behavioral. If somebody is steadily drinking over time, drinking too much on a regular basis, or binge drinking, if someone's engaging in that type of heavy drinking on a regular basis, that can be more likely to lead to alcohol-related problems or alcohol use disorder over time. So some other ones would be family history, and I think this gets at your question about why some people are particularly likely to become addicted and others aren't. The risk of an alcohol use disorder is higher for people who have a parent or another close relative who has had problems with alcohol. So there's some genetic component here. Depression and other mental health problems can also impact the likelihood of developing an alcohol use disorder. So it's common for people with disorders such as anxiety, depression, to have problems with alcohol or other substances. But again, it's sometimes unclear whether these mental health problems are more of a cause or an effect. And then just social and cultural factors. So having friends or a close partner who drinks regularly could increase your risk of an alcohol use disorder. And especially for young people, the influences of their parents and their peers and other role models can impact their risk.
So I'm curious as to what some of the consequences are of drinking too much. Can you talk about the physical health consequences associated with alcohol use?
Sure. So we could think about both acute or short-term consequences and long-term consequences. So in the short term, for example, injuries or even death is possible. Alcohol is a factor in about 60% of fatal burn injuries, drownings, and homicides. It's a factor in 50% of severe trauma injuries and sexual assaults, and 40% of fatal motor vehicle crashes, suicides, and fatal falls.
So it sounds like going to the emergency department is pretty common. So you're probably going to have more alcohol use disorders present in an ER or a trauma center. Is that correct?
Yeah, I would say screening for alcohol use disorders in an emergency department is a great idea, as a lot of these people are first seen in the ER due to other types of injuries that they may have related to their alcohol use. It's a great point.
So what about some of the long-term health consequences of alcohol?
So there's so many. People who drink heavily have a greater risk of sleep disorders, depression, sexually transmitted infections from unsafe sex, and several types of cancers. Most people think about the impact of alcohol on the liver, which is, of course, present. So the liver is an organ that helps break down and remove harmful substances from your body, including alcohol. And long-term alcohol use interferes with this process and increases your risk for chronic liver inflammation and liver disease. So you may have heard of cirrhosis, which is scarring caused by this inflammation. And as the liver becomes increasingly damaged, it has a harder time removing toxic substances from the body. But alcohol impacts much more than just the liver. So it can affect your heart and lungs. People who are chronic drinkers have a higher risk of heart-related issues than people who do not drink. Alcohol can also impact the digestive system. So drinking can damage the tissues in your digestive tract and prevent your intestines from digesting food and absorbing nutrients and vitamins. So as a result, malnutrition can occur. For people who drink heavily, ulcers and hemorrhoids aren't uncommon, and they may cause dangerous internal bleeding. Drinking too much alcohol can cause abnormal activation of digestive enzymes produced by the pancreas, and buildup of these enzymes can lead to pancreatitis, which can become a long-term condition and cause serious complications.
So I'm curious as to how alcohol impacts the brain.
So over time, frontal lobe damage can occur. This area of the brain is responsible for our emotional control, short-term memory, and judgment, in addition to other vital roles. When used in the long term, alcohol can also result in permanent memory loss and confusion.
So what about other physical health consequences? Like, does it impact any other systems?
Definitely. Again, it may impact pretty much every organ in the body, so it can impact the skeletal and muscle systems. It can reduce your body's natural immune system, making it more difficult to fight off invading germs and viruses. People who consume too much alcohol may also be at risk for cancer. So people who drink frequently are more likely to develop cancer in the mouth, throat, esophagus, colon, or liver. And people who regularly drink and use tobacco together have an even greater risk of these cancers.
Yeah, I guess I didn't realize just how much of an impact alcohol has throughout the entire physical body.
Yeah.
So talk more about like the mental health effects of alcohol use on a person.
Yeah, so in terms of impacts on mental health or behavioral changes, the ethanol in alcohol can cause damage to brain neurotransmitters. And if this damage is ongoing, it can result in all sorts of behavioral and mood changes. In particular, can increase risk for depression and anxiety. So as I mentioned earlier, depression and anxiety may be a risk factor for alcohol misuse, but it can also be a consequence of it. And we also talked earlier about alcohol use disorders. These are considered to be a psychological disorder. And in the US, about 17 million people have an alcohol use disorder, which is another important mental health impact.
Wow. So are men and women at equal risk for these alcohol-related health problems?
So research shows that women start to have alcohol-related problems at lower drinking levels than men do. And one reason for this is that on average, women weigh less than men. In addition, alcohol disperses in body water, and pound for pound, women have less water in their bodies than men do. So if a man and a woman who weigh the same drink the same amount of alcohol, the woman's blood alcohol concentration will still be higher, putting her at greater risk for harm. Women are also then at a higher risk for developing things like alcoholic liver disease. Their bodies are more likely to absorb more alcohol, and we need longer periods of time to process it. So we tend to show liver damage more quickly than men. And women are also more likely to develop heart disease due to drinking than men are.
That's really interesting. I guess when I think about who might be most at risk, I tend to think of men because men tend to drink more than women. Mm-hmm. But it sounds like we really should be screening equally for men and women because women, even though they may drink less or less frequently, may be at more risk from the consequences.
Yeah, I think there's some evidence that men might have higher rates of alcohol use disorders, and they definitely do drink at higher quantities, but you're right that women are at a disadvantage when it comes to the health impacts of alcohol.
According to information provided by the National Institute on Alcohol Abuse and Alcoholism, in 2015, there were 9.8 million men and 5.3 million women who had an alcohol use disorder.
So where does someone start?
I would suggest that for anyone thinking about treatment, it would be useful to talk to a primary care physician as an important first step. Primary care physicians can be a good source for treatment referrals and medications. And primary care physicians can also evaluate whether the patient's drinking pattern is risky. They can help craft a treatment plan and assess if medications for alcohol may be appropriate.
So you mentioned medications. Tell me about some of the pharmacological therapies that are available for alcohol use problem.
Sure. So some people are surprised to learn that there are medications on the market approved to treat alcohol dependence. The newer types of these medications work by offsetting changes in the brain that can be caused by an alcohol use disorder. And all of these approved medications are non-addictive and can be used alone or in combination with other forms of treatment, which can be valuable. So there are 3 medications that are currently approved in the US to help people stop or reduce their drinking and prevent relapse. And these include naltrexone, which can help people reduce heavy drinking, acamprosate, which makes it easier to maintain abstinence, and disulfiram, which blocks the breakdown or the metabolism of alcohol by the body, causing someone to have unpleasant symptoms such as nausea and flushing of the skin. So knowing that you might have those unpleasant effects as a result of mixing the medication with alcohol can help some people avoid drinking while taking this medication. I think it's important to remember, though, that not all people will respond to these medications and that for a given person, one might work better than another. But for a subset of individuals, these medications can be an important tool in overcoming an alcohol use disorder.
Well, and you mentioned earlier that, oftentimes having an alcohol use disorder is also concurrent with depression and anxiety and some underlying mental health conditions. So I would think it might also be important to address some of these underlying issues that medications may not address as well.
Yeah, so seeking therapy in addition to medication or other medications that are focused on helping somebody with the anxiety or depression. But again, I think talking with those kinds of things with a primary care doctor would be advised, because some of the medications for anxiety and depression might actually increase the impacts of alcohol.
Oh, that's really good to know. So what about AA and 12-step programs? I hear about these programs all the time. I know they're highly prevalent and most patients are really interested in these types of programs. Can you talk more about those?
Yeah, so I think that's what people think of when they think of alcohol treatment. So AA and other 12-step programs provide peer support for people who are quitting or cutting back on their drinking. And if they're combined with treatment led by health professionals, they can really offer a valuable added layer of support. We don't know a lot about how effective they are, honestly, so due to the fact that they are anonymous, it's really difficult for researchers to determine their success rates compared with other types of treatments that are led by health professionals, but it does seem that for some individuals they can be very useful.
So what are other types of treatment methods if a patient doesn't want to go to a 12-step program or they don't want to take medications? What are their other options?
Yeah, so behavioral treatments involve working with a health professional to identify and help change some of the behaviors that might lead to heavy drinking. And a lot of the behavioral treatments share certain features. So things like developing skills that someone might need to stop or reduce their drinking, or getting help to build a strong social support system, or setting and working to reach goals, or coping with or avoiding triggers that might cause somebody to relapse. And there's a few different types of these treatments. So for example, cognitive behavioral therapy can take place one-on-one with a therapist or in a group setting. And cognitive behavioral therapy, or CBT, would be focused on identifying feelings and situations that lead to heavy drinking and managing stress that can lead to relapse. So the goal in this type of treatment is to change the thought process that led to excessive drinking and to develop the skills necessary to cope with some of these everyday situations that might trigger problem drinking. Another example is motivational enhancement therapy, which is conducted over a short period of time to help a patient build and strengthen their motivation to change their behavior. So oftentimes patients might not yet feel that they're totally ready to make a change, and this therapy can help focus on identifying the pros and cons of seeking treatment, forming a plan for making changes, building confidence, and developing the skills needed to stick to the plan.
Great, that's really helpful. This has been a Project iCare podcast with Dr. Kasey Claborn and special guest Dr. Jennifer Merrill. If you liked our show and would like to learn more, check out our website at sites.utexas.edu/Health Innovation Lab, or find us on Facebook at UT Health Innovation Lab. Check out our website where you can find out more about Dr. Merrill and the resources that we discussed today, which will be linked in the description below. Thanks again for listening, and stay tuned to hear a brief introduction to Dr. Merrill's current research. Her work focuses on investigating the etiology and consequences of alcohol misuse among young adults, with a particular interest in the subjective evaluation of alcohol-related consequences. In 2014, Dr. Merrill was awarded a Career Development Award from the National Institute on Alcohol, Abuse, and Alcoholism to examine the impact that event-level alcohol-related consequences have on subsequent drinking decisions among heavy drinking college students.